Implant-supported overdenture. An implant-supported overdenture is used when all teeth are missing in the upper or lower jaw. This is an alternative treatment to the traditional full denture, which rests on top of the gum tissue. In this procedure, multiple implants are placed. The implants are typically left to heal for a few months. Exact time will depend on the quality of the bone where the implant is placed. Following healing, the implants are uncovered and a custom metal framework manufactured by a dental laboratory is screwed onto the abutments by the dentist. An overdenture is then placed on top of the metal frame. This denture fits over the restoration and attaches to it with clips or snaps. These clips and/or snaps make the overdenture more stable and enable it to stay fixed in place better than a conventional denture. They also make it easy to remove for at-home cleaning. If you are missing all of your teeth in either your upper or lower jaw, or in both jaws, implant-supported overdentures may be the best solution for you. Overdentures can provide the following advantages over traditional treatment options. Hold the denture in place. Help preserve surrounding bone by replacing the tooth root. Help prevent bone loss and jawline recession. Restore a more secure biting ability than traditional removable dentures. Improve appearance and self-esteem. Provide comfort and security in knowing the denture won't dislodge.